Cancer is uncontrolled cell growth and has currently become one of the major causes of mortality worldwide, causing nearly 9 million deaths in 2019. Underlying reasons for making cancer second most cause of death after cardiovascular disease is complicated, but age, growth of population, prevalence of risk factors, and socioeconomic status play a major part as contributing factors in the development of cancer. Therefore, our today's topic of discussion is approaches for cancer treatment. However, before going towards the topic, please like, subscribe, and press the bell icon so that you can enjoy every lecture. Amongst the most commonly used approaches for the treatment of cancer is surgical intervention. Nowadays, a variety of different surgical procedures have been adopted, including conventional procedure. This involves the use of surgical knives for the removal of cancerous tissues. However, this procedure is hectic and there is question mark on the efficiency of this whole procedure. Therefore, we have to move to other options. Second approach is the use of robots, also known as robotic assisted surgery or computer assisted surgery. During this procedure, surgeon sits at a station at short distance away from the person on the operating table. He uses camera and software to precisely remove the tumor by robotic arms with the accuracy of millimeter or even more. Next variant is cryosurgery, where liquid gases like nitrogen and carbon dioxide are used to freeze the cells. This procedure may be used for the surface tumor as well as inside tumor, for which surgical opening is required. A probe is inserted in the tumor and liquid gases are administered. A repeated cycle of freezing and thawing is carried out to kill the cancerous cells. However, pain, bleeding, and infection associated with this procedure have put full stop on the use of this technique. Next one is radiofrequency, with typical procedure of exposing body to high frequency radiation, also known as RFA. RFA uses heat to kill cancerous cells. Ultrasound or CT scan may be used to help doctor for guided probe insertion. High frequency electric field of between 300 to 500 kilohertz is applied. It is usually used to treat tumors of size less than 5 centimeter, mainly hepatocellular carcinoma, primary lung cancer, and pancreatic cancers are treated by this method. Next approach is the use of chemotherapeutic agent for the treatment of cancer. However, apple of discard in the arena of chemotherapy is targeting of cancer cells. When some drug is administered for cancer treatment, targeting may be achieved either by passive targeting or by active targeting because of enhanced permeation and retention. Generally and briefly saying, tumor growth at specific site results in solid stress due to increase in cell number. There is less nutrient supply, which results in hypoxia. This results in production of vascular endothelial growth factor VEGF. VEGF, along with vascular permeability enhancers like bradykinin, nitric oxide, and prostaglandin, increase these tight junctions between endothelial linings. This results in the escape and leakage of these carrier systems from main blood circulation to interstitial tissue space. This is known as permeation. The growth of cancer changes physiology and histology of this area, and there is increased accumulation of connective tissues like collagen, fibroblast, and immune cells. The presence of less lymphatic drainage along with these changes inhibit these carrier systems going back to blood circulation, known as retention. Then these carrier systems show their effect in this area. On the other hand, active targeting is obtained via modification of these carrier systems by antibody, aptamer, or other ligands. As here we can see, black carrier systems after modification are converted to red. These antibodies, aptamer, or ligands have specific binding affinity with cell receptors, proteins, DNA, or RNA. Here we can see binding of these carrier systems on cell receptor and nuclear membrane. This after binding specifically to target of interest, these moieties show their effect. Summarizing, we have learned about some surgical procedures and mechanism of targeted chemotherapy for the treatment of cancer. In next video, we will discuss some other techniques used for the treatment of this ailment. Please like, share and subscribe my channel and press bell icon so that you can watch all videos timely. If you are interested in some topic, comment below. We will try to follow as soon as possible. Bye bye.